10. Nurses have cleaner hands. Consistently, a large number of individuals get contaminations in medical clinics. Incidentally, it is the mindful hands of the clinical staff that transmit bugs between wards. Since this can cost lives, New South Wales propelled a year-long crusade to instruct labourers at open emergency clinics. After the activity finished in 2007, the University of New South Wales (UNSW) and the NSW Clinical Excellence Commission needed to know whether anyone at any point paid attention to it. Utilizing 4 examinations, they thought about the quantity of staff who cleaned their hands in the wake of visiting a patient. There was an improvement, yet low numbers despite everything appeared. Specialists who rehearsed better cleanliness rose from 26% to 38%. Medical caretakers improved from 54% to 65%. The specialists even lost to unified well-being laborers who went from 40 to 48%. 9. Incas were better than Civil War doctors. Cerebrum medical procedure is antiquated. The Inca culture exceeded expectations in trepanation, a cranial activity that cuts gaps in the skulls of living patients. In 2018, an examination analyzed 800 Inca skulls and found that the specialty began harsh however refined throughout the hundreds of years. By 1500 AD, up to 83% of Inca skulls had indications of mending. Increasingly amazing was the way that their endurance rate overwhelmed 19th-century troopers who confronted head medical procedure during the American Civil War. Almost 50% of them kicked the bucket. Specialists don't know why the Inca performed mind medical procedure, but rather it couldn't have been like the confused, understaffed field emergency clinics that without a doubt added to the war's setbacks. In any case, Inca doctors got a handle on the idea of disease and managed it successfully. How precisely they did that or what was utilized as sedation stays obscure. Common war activities, by correlation, was a contamination celebration. Specialists didn't clean their hardware or hands before burrowing inside injuries for shrapnel. 8. Pharmaceutical promotion skews prescriptions. A dubious part of the clinical world is pharmaceutical advancement. When does it go too far between making genuine arrangements accessible to specialists and patients, and treating both like a business where deals and benefits dominate moral clinical practices? In 2010, scientists from 9 foundations scoured all the accessible writing on the subject. It was a thorough exertion, however the investigation gave an answer. The pharmaceutical advancement was not something to be thankful for. The specialists who permitted it recommended more drug and delivered a more unfortunate endorsing quality than the individuals who didn't. The audit exhorted clinical experts to maintain a strategic distance from these business systems and rather look into data from sources without any connects to pharmaceutical organizations. Taking into account that tranquilize advancements rake in billions for those organizations, they may reject the audit's recommendation that their funds and advancements ought to be taken over by an autonomous organization. 7. Disgraced Dr. Oz on Government Council. For a considerable length of time, the Dr. Oz show was viewed by a huge number of watchers. Introduced by Dr. Mehmet Oz, the program won an Emmy in 2018. The specialist's ascent to progress was brilliant and he slammed similarly as hard. Most of his clinical counsel didn't hold up to examination, either. Actually, a recent report found that about portion of every one of Oz's cases were sucked from his thumb. Other than the unsafe data, the specialist whipped such a significant number of misleading weight reduction items that he was gathered to affirm before a Senate subcommittee. Despite the fact that his history of misbehavior is entrenched, this didn't prevent the Trump Organization from naming Dr. Oz to the Council on Sports, Fitness and Nutrition. The gathering plans to improve the country's nourishment and energize increasingly normal exercise. As of late, the chamber pulled together on kids. With Mehmet Oz now prompting the U.S. government on youngsters' physical well-being, numerous specialists are worried. 6. Doctors are mean. In 2012, Dr. Lucian Leap distributed his exploration and it was an invite confirmation for some patients. He accepted that an excessive number of his individual specialists were mean. He found that many individuals detest heading off to the medical clinic, since they are sick or harmed, but since they have had a past encounter where specialists cheapened them. Leap's investigations indicated the all-encompassing way doctors got out of hand around others. It extended from atomic passionate upheavals, cussing and tormenting staff to demonstrating little enthusiasm because of unresponsiveness or burnout. The most well-known issue was contemptuous treatment, putting down or disregarding patients. Leap found that an excessive number of individuals leave the crisis room feeling like specialists treat them like blockheads, another record or an issue. Anything aside from an individual. Evidently, clinical school ingrains a feeling of privilege since specialists hold an uncommon spot in the public eye. One might say that is valid. Be that as it may, Leap and numerous patients feel that a few specialists let this go to their heads. 5. The Dutch euthanasia case. The Netherlands has permitted specialists to euthanize patients since 2002. The demonstration is legitimate when a person's enduring gets unmanageable and assent is verifiable. As of late, a Dutch specialist was hauled to court for the principal killing to transform into a criminal case. The indictment felt that the patient couldn't give legitimate assent. The 74-year elderly person had extreme Alzheimer's. In any case, 4 years back, she composed an announcement enumerating the desire to be euthanized as opposed to winding up in a consideration office. There came a moment that her doctor chose the opportunity had arrived. 2 different specialists at that point assessed the circumstance and concurred. A date was set and the specialist, the patient, her significant other, and developed little girl had espresso. The 74-year-old's beverage was bound with a narcotic, however it neglected to take her out. Another portion was given by means of infusion. She rested, yet similarly as the specialist was going to allow her the second and deadly infusion, the lady woke and held up. Her family held her down and the medication was regulated. The court in the long run vindicated the specialist, saying that the profoundly maniacal condition of the patient kept her from confirming her desire to die that day and that the composed affirmation was sufficient. 4. They made a patient laugh during brain surgery. During certain mind medical procedures, the patient must remain wakeful. Specialists converse with them to guarantee that a few locales, similar to the one that handles language, stays unaffected. Obviously, a few people alarm in the wake of awakening from the underlying narcotic and reality hits. You know, your head is secured, set up, a bit of skull is gone and your mind is open. Patients have been known to freeze, get at their minds or battle the head support. In 2018, an epilepsy understanding experienced the strategy. For the most part, sedation and interruption keep patients quiet. This time, the specialists went the enjoyment course. It didn't begin great. At the point when the lady woke up, she was on edge to such an extent that she cried. Something should have been done before she turned out to be excessively bothered. The thought was to make her chuckle. Rather than playing around, the specialists animated a gathering of synapses called the cingulum pack. This district was accepted to control the mouth muscles during chuckling, however that it had nothing to do with feeling. As her primary care physicians had trusted she would, the lady refuted ordinary idea. She giggled her way through the surgery. 3. Doctors swallowed Lego on purpose. In 2018, 6 pediatricians thought about to what extent it would take a Lego piece to travel through the stomach-related framework. The specialists, all from the United Kingdom and Australia, hacked off the heads of Lego individuals and gulped the toy noggins. From that point on, things got somewhat peculiar. Every researcher needed to look over their own crap to discover the toy part once more. To help things apiece, they thought of fitting labels for their rating frameworks. For quite a long time in advance, and during the recovery stage, they reviewed stool consistency with the Schadt stool hardness and transit scale. At whatever point someone found a Lego head, it gave them a fart find and retrieval time. Toward the day's end, 27 hours to 3 days were required for a yellow face to go through a solid grown-up with no issues. Food scores likewise indicated that stool consistency stayed unaltered. This data would now be able to be added to the uncommon pool of studies exploring the immediate impacts of gulp toys. Be that as it may, everybody is likely, despite everything, asking why one of the 6 pediatricians never discovered his Lego head. 2. Fires break out during surgery. In 2019, an Australian patient experienced a crisis system. It was intended to address a tear in his aorta, not cause a fire close to the chest cavity, which is actually what occurred. The open-heart medical procedure began typical enough. Tragically, the patient's medical issues began a progression of occasions that lead to the fire. The man had an expanded lung, and when specialists coincidentally punctured it, they needed to make up for the air spill. They did this by expanding the measure of oxygen in the sedative. Since the patient breathed in the sedative, both the oxygen and sevoflurane narcotic got away through the lung spill. The careful group could smell the unstable blend noticeable all around. A flash from an electrocautery gadget arrived on a dry careful pack on the patient's chest. In the thickly oxygenated air, the pack combusted. The fire was quenched and the activity finished up effectively. It was anything but a one-time crack situation. This was the 8th chest pit fire caused during medical procedure. Much the same as the Australian case, they every included lung, electrocautery gadgets, expanded oxygen, careful packs, and sound patients. 1. Their DNA age faster. In 2019, DNA tests were taken from 250 specialists toward the beginning of their temporary job. A subsequent DNA test was done toward the finish of their first working year. The outcomes were upsetting. The initial year hands-on quickly matured the new specialist's DNA. In examination, others required 6 years before their DNA caused significant damage. The researchers found the amazing actuality when they took a gander at telomeres, which is regularly alluded to as the tips on chromosomes. It is typical for telomeres to shrivel with age, yet doubtlessly word-related pressure quickened the procedure in the understudies. Specialists who worked the longest hours, showed masochist character qualities or had tense family circumstances indicated the most exceedingly awful maturing. For what reason does it at any point make a difference? Contracting telomeres is certainly not something worth being thankful for. It spikes the hazard for malignant growth, coronary illness, and declining mental limit. Scientists are trusting the examination's outcomes would help change the severe hours that specialists face during preparing and beyond.